So, of all the stories, what's your favorite story?
Yeah, there's the very first story, which brings out a lot of things. It brings out the pioneering work that we did in the field of male infertility. In this story, I've described a technique called TISA-ICSI, testicular extraction of sperms with intracytoplasmic sperm injection. It's a very long word, and it took ages to master this technique. Aniruddha used to spend nights. I mean, the whole night he would learn this technique. We had foreigners coming down. And this story is about this pioneering work where today a man with a zero count can actually father his own baby. And this is the story. So I like this story because it does not bring out just the pioneering work or the medical advance. It also has many angles to it. I've brought out that our Indian system is a patriarchal system and a pro-natalist system where a woman is looked only for her childbearing. Nobody asks a woman what she does, who she is, or what work are you doing. I face this problem even today. When I go to a function, this is Dr.Aniruddha Malpani. And either I'm not looked around, nobody even introduces me, or I'm just said, oh, this is Mrs. Malpani. So, people just don't bother about it. So I brought this out in this, that because it's a patriarchal society where the man is the decision maker, he makes all the decisions, whether it is societal decisions, whether it is related to family, whether it's personal, whether it's reproductive. And I have titled, it's a very interesting title, it's called Tea and Coffee, where I've said, the couple comes to me, very intelligent couple comes to me and says, look, doctor, I don't have sperms, okay? But I want a baby of my own. Because in 92, 93, all we could do was offer donor sperm. He said, I don't want it. So I said, there's no technique. So he said, no, I'm sure there would be something coming up. So he waits 4 years till the technique comes up in Belgium. We learn the TISA-ICSI. He waits till we master the technique. We find sperms, a few sperms in him. I do TISA-ICSI on him. And then, by then, the woman's age has gone up. She's turned 38, 39 years. And when I started, doing a sonography, she has no eggs. Without blinking his eyes, he says, why don't you use donor eggs? Without thinking, without asking her. And this is what I wanted to show, that, how women are, we are basically just, we just have to look down and, accept the man's decision. So it's called Tea and Coffee, because the first time they visit me, I offer them, the man says, 2 coffees. The woman, he doesn't even ask her and says 2 coffees. She has it quietly. Second time, the same thing. Third time, she comes alone when I'm counseling her for donor eggs, and she says, tea. And I say, oh, how come? She says, all my life, doctor, I've had tea at my parents' place, but when I got married, nobody asked me. It was just assumed that I'm going to have coffee because they have coffee. And I said, but didn't you ask for tea? She said, no, I'm not supposed to. I was taught by my mother that, okay, you just do what your family does. So she was having coffee. And after that, she gets twins. And the last, when she comes back to me with the twins, and I say, do you want tea or coffee? And she looks at her husband and says, one tea. So it just shows, how. So that's my...
In fact, all your titles are very thoughtful, and I'm sure people will love them when they read the stories. So, Anjali, what's changed in the 33 years that you've been doing IVF?
Of course, technology has advanced so much that when I started, I think our success rate was just about 5%, 6%. And today the success has gone up to 40 to 50% for a single cycle. And if you take the cumulative success rate, it reaches almost 80 to 90%. Cumulative means if the same patient continues cycles for about 4 cycles or 5 cycles, there is a 90% chance that she'll get pregnant. So along with technology, I feel a little... Along with technology, I also feel a little bit the awareness has also increased. Though it's a stigma, I think the awareness is increased. So when I used to see patients years ago, the couple would come, or the mother-in-law would typically come and say, "Isko bachcha nahi ho raha hai." And I would look at the husband and say, "To aap kya kar rahe hai?" But today it's changed. The mother-in-laws bring their sons and say, okay, he may be having a problem. Or sometimes even men come on their own, boys come on their own. And another level, because probably their girlfriends have pushed them and said, do your sperm test, even before marriage. So they are doing that test. They are accepting that it could also be a male problem. If you see statistically, 40% of the time it's a woman's problem, 40% of the time it's a man's problem, 20% it's a combined problem, and 10% is an unexplained. Very few men know this, but today I think they're accepting it, so that's a big change. And the other thing is about social infertility. I've coined this word as social infertility, whereby young women are now having infertility, maybe due to men and women, both of them. The sperm counts are going down, and the egg quality is going down. Probably because of lifestyle changes, probably because of pesticides, probably use of plastics, obesity, we don't know what the reason is. There's something called social infertility, which is accepted because women now, girls don't want to get married early. They want to get married at a later age. Even if they get married, either they want to pursue their careers, or they want to, climb the corporate ladder, or they just want to have fun. They just want to travel, and nobody wants a baby. But what happens is fertility starts declining at the age of 30, 35. Your peak fertility is at 20 to 30. And as you reach 35, the egg quality goes down, and the number of eggs goes down. So even though you look healthy, you're eating the best of the food, organic food, whatever, from wherever in the world, your eggs don't know that. The egg quality does go down. And that's why the best time is to have a baby around the age of 30, 32, 33. And if you don't want a baby, then what young girls are coming is they're coming and freezing their eggs. It's a very easy procedure. You have to take hormonal injections for a few days. We do the egg retrieval and keep the eggs frozen. The eggs can survive for 10 years, 15 years. So if they want to have a baby, they have a baby. If they don't want, that's fine. So a lot has changed in this a few years.